Infusion therapy is delivered in all healthcare settings, including hospitals, home care, ambulatory clinics, physicians' offices, and long-term care facilities. After this lesson, you will be able to prevent IV administration errors by following best practices that ensure patient and staff safety, identify the evidence-based recommendations for prevention of intravenous catheter-related bloodstream infections, check the accuracy of prescriptions for IV fluids and drug therapy, identify the appropriate veins for peripheral IV catheter insertion, differentiate types of vascular access devices used for peripheral and central IV therapy, assess, prevent, and manage system complications related to infusion therapy. Infusion therapy is the delivery of medications in solution and fluids by parenteral route through a wide variety of catheter types and locations using multiple procedures. The most common reasons for using infusion therapy are to maintain or correct fluid balance, maintain or correct electrolyte or acid-base balance, administer medications, or to replace blood or blood products. Each IV solution is classified by its tonicity, aka concentration, and its pH. Tonicity is typically categorized by comparison with normal blood plasma as osmolarity. As discussed in Chapter 13, normal serum osmolarity for adults is between 270 and 300 milliosmoles per liter. Parenteral solutions within that normal range are isotonic. Some examples would be 0.9% normal saline, D5W, and LR. Those fluids greater than 300 milliosmoles per liter are hypertonic, aka more concentrated. Some examples would be D10W, 5% dextrose, 0.9% normal saline, 5% dextrose and 45% normal saline, and then 5% dextrose with lactated ringers. And then those fluids less than 270 milliosmoles per liter are hypotonic, aka less concentrated. One example would be 45% normal saline. Table 13-4 in Chapter 13 will list the common IV solutions according to their tonicity. Okay, so let's discuss isotonic infusate. What happens is water does not move into or out of the body's cells. Remember that patients receiving isotonic solutions are at risk for fluid overload, especially the aging population. In this image, you see the isotonic environment. The solute concentration and the free water concentration are the same inside and outside of the cell, so therefore water flows in and out of the cell at an equal rate. Okay, now we're going to discuss hypertonic infusate. Hypertonic infusions are used to correct fluid, electrolyte, and acid-base imbalances by moving water out of the body's cells and into the bloodstream. One example of hypertonic infusions would be parenteral nutrition. Okay, this image depicts a hypertonic environment. The solute concentration is greater on the outside of the cell, and the free water concentration is greater on the inside of the cell. Free water flows out of the cell. Do you remember why? That's correct, to even out the concentration to maintain balance. Now let's discuss hypotonic infusate. During hypotonic infusion, it is the process of moving water into the cells to help expand them. Hypotonic is also the same as hypertonic. Patients receiving these type of fluids are at risk for phlebitis and infiltration. This image depicts a hypotonic environment. The solute concentration is greater inside the cell, and the free water concentration is greater on the outside. Free water then flows into the cell. Okay, now we're going to discuss the different types of IVs. A peripheral IV therapy is usually placed in the veins of an arm. Catheter sizes range from 3/4 to 1 1/4 inch, and they're usually about a 14 to 26 gauge that are color coded. At times, a transilluminator may be used to locate the vein to insert the IV catheter. The most appropriate veins used are the basilic, the cephalic, and the median veins. Here's an image indicating the common veins utilized for peripheral IV insertions. Continuing with intravenous therapy, another peripheral intravenous therapy is the midline catheters. They range from 6 to 8 inches long. They are inserted in a vein into the antecubital fossa, and the tip of the catheter is located in the upper arm below the axilla. It's commonly used for therapies that are going to last 1 to 4 weeks of infusions. And the fluids that are being infused should have a pH between 5 and 9 and osmolarity of less than 500 milliosmoles per liter. And one of the central intravenous therapy is a central intravenous catheter. This catheter is placed in the superior vena cava. If it is in the subclavian, then that is a deep peripheral used instead. And you do not want to run TPN through it unless it is a SVC. The different types of central intravenous catheters are a PICC line, a non-tunneled or tunneled catheter, ports, and dialysis catheters. Someone that has a central intravenous catheter, you do not want to use the same arm for blood pressures or venipunctures. With these type of IVs, you use only a 10 milliliter syringe to access the catheter. There is a potential for arrhythmias if the catheter enters into the right ventricle of the heart. Continuing with the central intravenous therapy, first we will discuss the peripherally inserted central catheter, also known as a PICC line. This is generally placed in the antecubital fossa or the middle of the upper arm. The PICC line is generally 18 to 29 inches long. Generally, the tip resides in the superior vena cava. A chest x-ray is indicated to be sure the tip resides in the lower superior vena cava before it's used for infusion. It could either be a single, double, or triple lumen PICC line. Generally, a SASH method of flushing is needed. SASH is the acronym for saline, administering medication, saline, and then heparin. And always remember, positive pressure technique is used when flushing. Okay, continuing with the central intravenous therapy, we will now discuss the non-tunneled percutaneous central catheters. These are inserted by the physician. They are inserted in the subclavian vein in the upper chest or the jugular veins. The tip resides in the superior vena cava. It is also confirmed by a chest x-ray. Generally used for short-term therapy such as 7 days. The patient is placed in Trendelenburg for placement. There is an increased risk of bloodstream infection with the tracheostomy. And you want to teach the patient Valsalva maneuver to prevent an air embolism during insertion and also when it is removed. Okay, so for the next central intravenous therapy, I am going to discuss the tunneled central venous catheter. There will be tissue granulates into the cuff. It does provide a mechanical barrier to microorganisms. It requires a surgical technique for insertion. The different types are the Broviac, the Hickman, the Groshong, and the Leonard. This is generally for long-term therapy, and this is generally chosen when the PICC line is ruled out. Okay, so let's discuss tunneled central venous catheters. One of the types we said was the Groshong catheter. This type has a closed end with pressure-sensitive two-way valve. So the pressure-sensitive valve restricts backflow of blood and air embolisms. It eliminates the need for heparin and no need to clamp because it is a closed system. Basically, 5 cc's of normal saline flushing is required only every 7 days when it's not in use and after each use when it is in use. Okay, another type is the Hickman and Broviac catheter. The Hickman has a larger diameter catheter and is used in adults. The Broviac is used in children and smaller adults. Okay, for flushing you will use heparin and it equals about 100 units per ml. Therefore you will use 3 mLs every 12 hours and PRN. Okay, moving on to implanted ports or vascular access port, VAP. It is placed in a sub-Q pocket surgically created, generally located in the upper chest or the upper extremity. It involves the subclavian or the internal jugular vein. It will either be a single or double lumen. Access is used by a non-coring needle only, also known as a Huber needle. It is accessed through the chest, and these implanted ports can actually tolerate 2,000 punctures. There is actually a risk for needle stick by the nurse. It is flushed after each use and at least once per month. Okay, so let's briefly discuss dialysis catheters. These type of catheters have very large lumens. They can be tunneled or non-tunneled. Problems associated with dialysis catheters are catheter-related bloodstream infections and vein thrombosis. Key thing to remember, do not use for administration of fluids. Okay, so let's talk about a few alternate IV infusion sites. There is the intraperitoneal infusion, the subcutaneous infusion, the intraspinal infusion, and the intraosseous infusion. This image depicts an intraosseous therapy. IV drugs provide a rapid therapeutic effect but can lead to immediate serious reactions called adverse drug events. Hundreds of drugs are available for infusion by a variety of techniques. As with all drug administration, nurses must be knowledgeable about drug indications, proper dosage, contraindications, and precautions. IV administration also requires knowledge of appropriate dilution, rate of infusion, pH and osmolarity, compatibility with other IV medications, appropriate infusion site, potential for vesicant or irritant effects, and specific aspects of patient monitoring because it is immediate effect. Before beginning IV infusion, a physician must write a prescription that includes specific type of fluid, rate of administrations, drug name, specific dose, route, frequency, time, length, and purpose of administration. Okay, we're going to talk about some different complications of intravenous therapy. So some of these complications are infiltration, extravasation, phlebitis, post-infusion phlebitis, thrombosis, thrombophlebitis, ecchymosis and hematoma, site infection, venous spasm, nerve damage, circulatory overload, speed shock, allergic reaction, and/or catheter embolism. One serious complication is pneumothorax. It's most common with insertion of a central venous catheter into the subclavian or the internal jugular vein. Use the acronym ACT, ACT, acute respiratory distress, chest wall asymmetrical, and tracheal shifting. Another severe complication would be an air embolism. There's an intake of air into the central venous system during insertion or tubing changes. They will have respiratory distress, they will have decreased blood pressure, and they will have a change in level of consciousness. You can have traumatic and systemic complications. This is known as a central line associated bloodstream infection. You want to use strict sterile technique. You want to make sure you keep the system closed as much as possible. And you want to teach your patient aseptic techniques. This concludes this lesson of infusion therapy. If you have any questions related to this lesson content, contact the instructor. There is subsequent videos that will be provided that will give you demonstrations of IV insertion, port accesses, and sterile and non-sterile IV site dressing changes.